Hey, thanks for joining. If you're coming here because you joined our previous video, this is going to be a continuation of the conversation that we already have, so bear with me for 60 seconds. If this is the first time you're seeing one of our videos, I appreciate you watching, but let me tell you what we've already covered. The idea of how you attract patients into your facility or your marketplace has changed drastically, both in how they do research, how they pay, and how they go about making decisions. So today we're going to talk about some of the new techniques that we have been implementing and that you can use to ensure that your marketplace is something that you can control. The ones who take advantage of this now are going to see a huge benefit in the coming years as we keep seeing this shift happen. The biggest shift is buyers are informed more than ever. And if you're not being the one to put in front of them when they're looking to make a buying decision, you're going to be left out to the side. So let's take a quick minute and explain what we're talking about. Internet marketing, marketing as a whole. You used to be able to have certain platforms you could put yourself in front of. Maybe it used to be the newspaper. It used to be a magazine. Nowadays, we know that typically doesn't work as well because of the longer shelf life, the inability to track. So nowadays, we have this thing called internet search marketing. And internet search marketing, it used to be you could go on one platform. Now, one of the first ones that you could buy ads on was Google. So it was really simple. You took keywords, in those keywords, you delivered an ad that you would pay for, and then if they clicked on it, you got charged. It was pay per click. So we call that PPC. The next one is you started getting platforms socially, like Facebook. Okay, so that's another one, which then went to a platform that they purchased called Instagram. If you didn't know that, Facebook actually owns Instagram. Then you have the other bajillion websites that allow ads to be run on their site, and a lot of times it's pushing off of these platforms. So this, and we're just going to say other. Let me give you an example. Have you ever noticed that you started searching on the internet for a specific item you were buying or a topic, and then you noticed that everywhere you went on the internet, you just happen to see ads around the same topic that you were looking up? You're being tracked, you're being tagged, and then you're being influenced to buy a certain product from a certain company. Now, here in healthcare, we have this same exact thing. We have the ability that as people do research, we're giving them targeted information to deliver what they're looking for. In this case, it might be to put them in touch with one of your doctors for a free appointment. It might be to come in for a consultation to learn how you can provide them the relief that they're looking for. So nowadays, you can't just be on one platform. If you just sit inside of this one, you're not going to have a hard time reaching some of these other ones. So you have to look at it from a total campaign standpoint. So that campaign has to be built effectively to make sure that we're getting all the traffic. So let me give you a couple examples. So, when I say facility, let me be clear. It could be a facility, you could be a clinic, you could have 5 doctors working for you, you could be an entire hospital, you could be an ASC. This works. Everybody has buyers. There's buyers out there for everyone. How you get in front of them is what we're talking about. So let's talk about 4 different areas that we go about marketing now, which is typically not done. The first thing is you must have a true campaign. That's number 1 here. A true campaign is designing everything for a total outcome of the person that you're trying to interact with. So again, a campaign is a total outcome, or I should say a total desired outcome of what we want the marketing to do. We spend more time in this category than all of this other stuff. I had a client we recently worked with that we spent no less than 45 days doing nothing but talking about true campaigns. We had to get in the seat of the person that we were working with and talk about what the patient was looking at every stage of the funnel. This true campaign, once it's done correctly, you can actually start driving traffic to it. A poor campaign is set up for failure from the get-go. If you're in any kind of healthcare revenue cycle, you always heard, hey, garbage in is garbage out, meaning if you don't have good information in, it's never going to come out and it's not going to clean itself up. A true campaign, marketing campaign is the same way. Until you have totally defined what the true desired outcome is, nothing else is going to truly work because you're not going to connect the right dots. So let's assume we get total desired outcome done. The next one, we have geo targets. This one is pretty crazy. So let's say this is a city map. And over here is your facility. Now, we have competitor A, competitor B, competitor C. These are their buildings. Nowadays, because we all have one thing in common, most of us, all of us, we have this. These devices can make our life so convenient, but it also makes it very easy to put a message in front of you. You can now geo-target certain areas. Let's say we want to put a geo-target around the competitor's building that will display ads specifically to that. This all also contains something called a MAC address. Every phone has one. So you can now have a population that if I know, let's say that it's 1,000 people a day, we're going into competitor A's facility. We could build a custom campaign that just targeted those 1,000 people to put in your true desired outcome, which will then go back into the funnel that we talked about as far as maybe it's a link or a video that goes into a further call to action. So geo-targeting, we can actually target areas that, let's say you're an orthopedic group and you want to target the sports complexes in your area. You could put it in there so people at a sports complex and they're on their phone and they're on a website, you might see an ad for an ortho group that is down the road. Something might happen, maybe there's an injury, you know they're a sports client, you know they're a sports athlete, that's probably somebody you want to be in touch with if the point that they need an orthopedic procedure or an orthopedic opinion. Geo-targeting is kind of crazy because it can be done all across the country very easily as long as you have your true campaign built. The next thing is search tagging. So a search tag is going to be somebody that goes online, could be multiple platforms, and is searching for your specific keywords. Once we have this defined, you're going to have keywords, and these keywords are going to be key things that people are searching to typically find your procedure, your clinic, your service that you offer. These keywords can then be defined and tagged so the audience that you're communicating to is all going to come up in this search category. The last one is behavior. So people are going to have certain behaviors, and I'm going to use the auto industry because they use this probably more than anything. If I start looking at auto loans, then I'm going to start getting an ad for a car, then I'm going to start getting an ad for insurance, and it just keeps going, it keeps going. It's no different than we can start looking at behavior. If somebody's on the internet searching up a procedure or they're searching up how much something costs in the medical field, like these are behavior patterns that you can pick up on and then deliver what you're looking for. So geo, search terms, behavior, these are how we build our campaigns. So once we have this funnel established, we then look to turn to these techniques to drive the traffic, and then we can report on all of it. That's the beauty of it also. I could literally tell facilities who walked into the competitor's building, left, and then maybe within 30 days walked into your facility. This is something that is not necessarily new in the marketing space, but it's only had access for some of your bigger players. As healthcare keeps changing and the deductibles go up and cash becomes more and more of a payer, the research behind medical procedures is going to change drastically. So I hope this was informative. There's a lot of information about this on the internet. You can do your own research. If you have any questions and you would like us to kind of dive in and maybe help work with you on that true campaign, that total campaign, you can reach out to us. I'm sure wherever you're seeing this video, there's going to be a link somewhere of how you can get in touch with us and we can talk a little bit further. If anything else, I hope this video was informative and helped you. Thanks for watching.